Hello, my name is Jeff Kuklinski, and I am an emergency medicine physician and the chief of the Division of EMS here at Lehigh Valley Health Network. And I wanted to take a moment to talk about your safety in the era of COVID. As we all know, the numbers of positive COVID-19 patients are on the rise. We are now seeing numbers higher than we have seen in the initial wave. As a result, you, as first responders, are at increased risk of contracting the illness unless you protect yourself. Unfortunately, we are starting to see more and more of our first responders affected by COVID-19 on a daily basis. We are receiving daily requests to help them with testing and quarantine issues. So, what can we do to help protect ourselves as first responders? I know we are all done with masks and 6 feet rules and all have PPE fatigue, but these measures do make a difference. So, you should be wearing a mask and practicing social distancing anytime you're outside of your home. This includes in the station, between calls, during meal times, while attending educational sessions, as we all know that skills reviews are just around the corner, in the vehicles while on a call, and between calls. At this point, I think it's safe to assume that every patient is potentially COVID-19 positive. I recommend that you use goggles for every patient in contact and strongly consider adding an N95 for those same contacts. An N95 will increase your protection on every patient encounter. You should certainly add an N95 and a face shield for anyone with upper respiratory symptoms, fever, or concerns of COVID-19 infection. You should be placing a mask on every patient. LVHN will replace those masks for you on a one-to-one basis. I do not recommend using nebulized medications due to the increased risk of disease spread. If you feel a patient needs a nebulizer, then I recommend you administer the nebulizer in the patient's home or outside of the ambulance. You should never bring a patient into the hospital with the nebulizer running, as this increases the risk of spread to you, your partner, hospital staff, and the visitors in the emergency department. And do not forget, if you are performing an aerosolized generating procedure, you should be in a gown, gloves, goggles, face shield, N95, or a respirator. These procedures would include nebulizers, CPAP, and intubation. CPAP does increase the risk of spread and should be used sparingly. If you are performing aerosolized generating procedures, please inform the emergency department prior to your arrival. And finally, clean, and do some more cleaning. Deconning on trucks on a daily basis, and especially after treating a highly suspected positive patient, will decrease your risk of cross-contamination. As always, we are here to help you if you have any concerns about COVID-19, your protection, or any current treatment recommendations. If you or your service find a need to have providers tested due to symptoms or a high-risk exposure, or have questions about quarantine issues, please contact our EMS liaisons, Sean and Kyle, and they will be able to walk you through the entire process. I thank you for all that you do for your patients, and please remember to be safe in order to protect yourself, your family, your partners, your organization, and definitely your community.